Bolton and Co. Coming up, another drought threatens millions in Africa. But is there more than just weather to blame? We're joined by Justin Forsyth, the CEO of Save the Children, and Ayo Johnson from Viewpoint Africa after the break. See you then. "26 years on from Live Aid, Ethiopia and its neighbours are in the grip of a debilitating drought. Millions are suffering from food and water shortages after the driest year in a decade. Some parts of Kenya have received just 10% of the usual level of rainfall. The drought has affected nearly 10 million people across the Horn of Africa. The price of grain has doubled in Somalia and Ethiopia, and 22 million livestock are currently in urgent need of food.
Well, with us now are Justin Forsyth, who is the CEO of Save the Children, and Ayo Johnson, the Director of Viewpoint Africa. Welcome to you both. Justin Forsyth, clearly there is a drought problem, but are people now suffering and indeed dying because of the drought or because of war and political failure?
Yeah, they are dying because of the drought. I mean, but also it's complicated by these high food prices, and in Somalia by conflict. So it's that combination. It's like a triple whammy of different impacts on their lives. I mean, one little girl that I just heard about today was carried by her family for 22 days out of Somalia, finally got to this huge refugee camp of over 300,000 in Kenya, and sadly died of malnutrition. So kids are dying, and over half the people affected are children. And it's usually a combination of severe malnutrition with illnesses like diarrhoea, pneumonia, malaria that really tip children over the edge. So it's extremely severe.
Would you share that analysis?
It is severe, it's quite serious, but I think it's compounded by the fact that we've got weak infrastructure in Africa, especially with some of the governments, compounded by the fact there's excessive poverty. When you mix that with the fact that we've had drought, which goes on for a long time, especially parched summers, poor technique, especially to do with harvest, these sort of problems become
one
more
question
pronounced.
Why do people have to come out of Somalia? Why can't they be helped in Somalia?
Well, you can't change how people move around, nor can you affect or change the way the aid or the support comes into a system. So I think it's just a fact of life, the way governments work, the way institutions operate, and very much how charities operate.
I think Somalia is tragic. I mean, I was in Somalia 20 years ago, and 300,000 people died in a famine then. Now we're seeing over 1,000 Somalians walking across the border into Kenya, many of them, half of them, children with blisters on their feet. Their animals, over 60–70% of them have died. They've had to use the straw on their roofs of their houses, in their mud huts, to feed their animals. These kids are really on the edge, and we can act now to prevent it becoming a full-scale starvation. We and other aid agencies, Save the Children and others, warned on this 4 or 5 months ago. If the international community spent as much money on prevention as it does on actually dealing with the famine and starvation once it happens, we'd actually be able to stop this becoming much worse.
And Ayo Johnson, this raises the question of aid and whether it actually serves the purpose that it is meant to do, doesn't it? Because there are some who say actually we need to help Africa help itself rather than just sending in food parcels and sending in money that doesn't actually help them in the long term.
Absolutely. Why give a man fish to eat when you can teach him how to fish? So absolutely, I think Africans need to be far more responsible. At the same time, they've got to be given the mechanisms to be able to do it themselves in the long term. But we must distinguish between the sort of aid that we're talking about here, which is emergency aid, relief aid, aid that saves lives, compared with the aid from government to government, which is large chunks of money that are given to governments, which leads to the dependency syndrome, which I'm afraid is not necessarily good for Africa as a whole.
But even aid in these worst situations can help build local resilience. I mean, we ran a scheme in northern Kenya where we don't give out food aid. We give out vouchers and cash, and people have to retrieve the vouchers in the local market to buy food in that market.
So you're stimulating the local economies as well, and there have been pilot trials of mobile phone top-ups of cash as well.
All of that. So aid has actually changed dramatically in the last few years. Even in Somalia, we run schemes that actually stimulate the local economy by people buying these animals, the kind of the schemes that you're talking about. The trouble is that the money for those schemes that build resilience and prevent famine are actually very poorly funded in comparison to when the crisis hits. You get huge amounts of money.
I mean, what could and should have been done when you say you were warning about this 4 months ago?
Well, we should have acted early. We should have put a lot of money in there to actually help keep people in their homes so they didn't leave them, so that we actually invested in stimulating the local economy. We invested in boosting the agriculture in these areas. But it is tough. I mean, I don't want to skirt around this. This is the worst drought in over 60 years, not just in the last decade, but in the last 60 years, compounded by high food prices. And in somewhere like Somalia, conflict plays a major factor in tipping it over the edge. So this is a very tough environment to work in. And our staff, hundreds of them on the ground in places like Somalia and northern Kenya, have to struggle to keep kids alive. But our objective is actually to deal with the underlying causes at the same time.
You talked, Justin, about people travelling huge distances across Somalia to try and get aid, to get into refugee camps. When they do arrive, is there space for them now?
Well, this refugee camp, Dadaab, is hugely overflowing now, and over 1,000 people are arriving every day. So, but we are able to help. We have feeding centres there with other NGOs. We're providing water, healthcare. So we are saving kids' lives. We are helping their families. But it is tough, and we're right. The clock is ticking, and we have to act in a huge way very quickly if we're going to prevent this moving into a full-scale famine and starvation. But we can act now, and it can work if we act very quickly.
So, Ayo Johnson, in your view, what is needed now?
I think lives have got to be saved. We need emergency aid to go in quickly. Smart aid, I would say, aid that would meet the immediate needs, and very much how we can ensure that we have mechanisms in place to make sure it doesn't happen in the future, because we can't be going on year on in the same type of fashion.
And is that response there? Are you getting that response from government?
We are. The British government have been very generous, but other governments now need to step up to the mark, and the British public, as usual, are being extraordinarily generous.
I mean, how much money are we talking about overall?
Well, we've appealed for 40 million. This is the biggest emergency operation. We've got hundreds of people, even in the very tough areas like Somalia, on the ground, feeding centres right across the centre and southern bits of Somalia. Really, really difficult places to work. You can actually save children's lives, and we can help get people through this tough period. But then, as you say, we need to really then look at how we address the underlying causes. And it's not all bleak. In Ethiopia and Kenya, they've made huge progress in the last 20 years.
I mean, people shouldn't say, well, you know, I donated to Live Aid and it was all a waste of time, because we're back where we are.
No. I mean, I think in Kenya and Ethiopia, big steps forward have been made. A lot more children go to school in these countries. There's more food security. But high food prices combined with the worst drought. I mean, Somalia is different. The conflict there makes it very tough.
Combined with piracy, not to mention the difficult conditions on the ground to do with culture and customs. Can you imagine someone going on the ground to actually assist people, and if they don't understand what the norms are, what the cultural implications are, especially when you're dealing with kids that have the effect that affects their moms, and then you're looking at the wider family context, the impact and the effects are very, very severe.
I just want to ask you, Justin, about the terms that we're using here to describe this, because we're talking about this being the worst drought in 50, 60 years. We're not yet talking about a famine, are we? But are we close to that?
We are close, and children are already dying of malnutrition and disease, but we're not in a full-scale famine situation yet. There is still time to act to prevent this, and though we have lots of examples of children dying before they get to our feeding centres, or dying even when they get there from illnesses, we can prevent this tipping over into a full-scale starvation and famine, but we do need to act now.
26 years on from Live Aid, Ethiopia and its neighbours are in the grip of a debilitating drought. Millions are suffering from food and water shortages after the driest year in a decade. Some parts of Kenya have received just 10% of the usual level of rainfall. The drought has affected nearly 10 million people across the Horn of Africa. The price of grain has doubled in Somalia and Ethiopia, and 22 million livestock are currently in urgent need of food.
Well, with us now are Justin Forsyth, who is the CEO of Save the Children, and Ayo Johnson, the Director of Viewpoint Africa.